During the COVID-19 public health emergency, which is still in effect, states must provide continuous Medicaid coverage. As a result, with very limited exceptions, beneficiaries have not been terminated since March 2020, even those who are no longer eligible for Medicaid. After the PHE's requirement for continuous Medicaid coverage ends, states will return to normal operations and eligibility determinations. This is referred to as the PHE unwinding. At that time, hundreds of thousands of Floridians will begin receiving notices from the Department of Children and Families that they need to renew their Medicaid eligibility. And many enrollees will subsequently receive notices that the Medicaid coverage they've had throughout the pandemic is ending. Medicaid is complicated, and many enrollees will need help in understanding if their Medicaid termination notice is correct. This video and the portal resource materials have been created as a basic training tool for legal services staff, navigators, social service providers, and others who will be assisting Florida Medicaid recipients during the unwinding of the PHE. The video will provide a general overview of Florida's Medicaid program, including who is eligible for coverage and how to determine the income eligibility for different family members. It will also explain why Florida's parents and caregivers are among those most likely to lose Medicaid after the PHE's continuous coverage requirement ends. To help you get the most out of the presentation, we divided the video into topics and provided timestamps so you can easily go to the desired content. Additionally, we've included important materials in the portal located directly below the video, and those materials will be regularly updated. There's a lot we don't yet know. As of July 2022, we don't know when the PHE's continuous coverage provision will end. More information on dates regarding the status can be found in the portal's resource materials. We also don't yet know what the Department of Children and Families' official plan for the unwinding will be, or what all the notices that will be used during the unwinding will look like. We do have copies of some current DCF notices in the portal. When new information is available, the Florida Health Justice Project will provide updated materials, including what DCF's notices and policies will be during the PHE unwind, and how to help enrollees who need advice or assistance in appealing a Medicaid termination notice. Before we turn to those groups most likely to lose Medicaid during the PHE unwind, it would be helpful to do a basic overview of Florida's coverage categories. In order to be eligible for Medicaid in Florida, someone must be in either a family-related coverage group, which includes parents or caregivers of a minor child, pregnant women, and children, or in what is called an SSI-related coverage group, which includes people who are age 65 or older, blind, or disabled. This chart from DCF shows the Medicaid income limits for individual family members, including adults, pregnant women, infants under age 1, children age 1 through 5, and children age 6 through 18. If you are helping someone figure out the Medicaid eligibility for different family members, this chart is an essential resource to bookmark and understand how to use. The chart and other reference materials for family-related Medicaid coverage groups can be found in the portal. Let's walk through a hypothetical situation in which your nonprofit is helping people understand if they will still be eligible for Medicaid after the PHE ends. For example, you are scheduled to interview a mother of 3 children, age 4, age 18, and age 19. In addition to the ages of the children, the information from the intake notes you were provided before the interview indicates that everyone in the family has been on Medicaid since March 2020, when the mother lost her job early in the pandemic shutdown, and that the mother is now working, but the notes do not provide her income. There are rules referred to as MAGI, which stands for Modified Adjusted Gross Income, that apply to family-related Medicaid eligibility determinations. And those rules and reference materials are in the portal. But for now, you just want to figure out what the relevant income limit would be for each family member before your meeting with the mother. Here's how you do that. Starting with the mother, beginning in the far left column of the chart, you know that the family size is 4. Moving to the right, you see the column labeled parents, caretakers, children 19 and 20, and the number there is 364. Continuing to move to the right on the chart, you see a column titled Standard Disregard, and the number is 221. And moving to the far right, the last column is titled Magi Disregard, where the number for a family of 4 is 116. So after you add up these numbers, you know that if the family income is more than $701 per month, the mother will no longer be eligible for Medicaid. For the 19-year-old, again, you go to the chart. And as you can see from looking at this column for adults, the family income will be the same for the 19-year-old. 364 plus 221 plus 116 for a total of $701 a month is the maximum monthly income for the 19-year-old to remain eligible. However, there are special circumstances in which the 19-year-old could apply for Medicaid as a household of 1, where the income limit is much lower. Those situations are described in a Q&A that is found in the portal materials. For the 4-year-old, you also start on the far left of the chart with a family size of 4. Move to the right to find the category for the child, and you see the column titled Children 1 through 5. And the number in this column for a family of 4 is 3,076. Again, moving to the right, you then add the standard disregard of 162. And moving to the far right, you add the Magi disregard of 116. So after you add up those numbers, you know that if the family income is no more than $3,354 a month, the 4-year-old will still be eligible. For the 18-year-old, again, you start on the far left, find the line for a family of 4, and move to the right. The income limit for the 18-year-old is also $3,076, but there is no standard disregard for older children, age 6 to 18. You only add in the Magi disregard in the far right, which is the same, 116. So after you add up those numbers, you know that if the family income is no more than $3,192 a month, the 18-year-old will still be eligible. Now let's look at the groups of current recipients who are most likely to lose Medicaid when the PHE ends, starting with parents and caregivers who are now over income for Medicaid. And there is a Q&A for this group in the portal materials. Let's go through an example that is in the Q&A. Zoe, a single parent with 2 minor children, lost her job in April 2020 and enrolled in Medicaid along with the kids. She got another job in June 2020 with a monthly income of $1,000. Going back to the chart, you can see that under Florida's normal Medicaid rules, Zoe will no longer be eligible because the income limit for parents with a family of 3 is only $303 plus the standard disregard of $183 plus the Magi disregard of $96 for a total of $582 a month. So with an income of $1,000 a month, Zoe is well over the limit. Along with parents and caregivers who are now over income for Medicaid, another group of adults who will lose Medicaid after the PHE ends are those who no longer have any children under age 18. There's a Q&A for this group in the portal materials, which explains that under regular Medicaid rules, adults who qualified for Medicaid as a low-income parent or caregiver lose their eligibility when they no longer have any minor children. Let's go through an example that is in the Q&A. Angela, a grandparent taking care of her youngest grandchild, Hugo, lost her job and enrolled herself and Hugo in Medicaid in April 2020. Hugo turned 18 in May 2022. Angela has not gone back to work. She still has no income, but because Hugo is no longer a minor, Angela is no longer technically eligible for Medicaid as a low-income caregiver. It is important to remember that when someone loses Medicaid under their current coverage group, they may still be eligible for Medicaid under another group. Zoe, for example, who is over income for coverage as a parent, might still be eligible for Medicaid if she is pregnant. Or Angela, who is no longer eligible for coverage as a caregiver because she is not taking care of any children under age 18, might be eligible for coverage if she is 65 or older or disabled. And so before terminating their coverage, DCF must review their files and determine if they are eligible for a different Medicaid coverage group. Under Medicaid law, this is part of what is referred to as the ex parte requirement, and there are materials about it in the portal. Also, when DCF sends a notice of case action terminating Medicaid because a recipient is over income for their current coverage group, the notice should also inform the individual that they have been enrolled in the medically needy program and specify the individual's share of cost, which is like a deductible in an insurance program. More information about medically needy is in the portal. For example, let's assume Zoe, who is now over income for the parent coverage group, is also neither pregnant nor disabled. So during the unwind, she will get a notice from DCF saying that her Medicaid has ended and that she is enrolled in medically needy with a share of cost of $514. Under the medically needy program, Zoe would be eligible for Medicaid coverage for those months in which she incurs medical bills of at least that amount, $514. To check if her share of cost was correctly calculated, you look again at the chart for a family size of 3, find the column labeled MNIL, which stands for medically needy income limit. You subtract that number, 486, from her monthly income of $1,000. And so you can inform Zoe that her notice is correct with regard to her Medicaid termination and the medically needy share of cost. Additionally, many women losing Medicaid should be enrolled in the family planning waiver. This is a program which provides family planning health services for women under 56 who are losing Medicaid coverage because they are no longer eligible and whose family income is below 191% of the federal poverty level, which is about $2,900 a month for a family of 2. While the medically needy program and family planning waiver are clearly not a substitute for the full Medicaid coverage that many parents and caregivers will be losing, the good news is that many will be eligible for a subsidized healthcare plan in the ACA marketplace. The Covering Florida program has navigators in each region of the state who are eager to help people losing Medicaid after the PHE unwind begins. The navigators can explain a person's healthcare options and assist with enrollment in a new low-cost healthcare plan. The map with local contact information and other materials can be found in the portal. And before the PHE begins, there are some actions parents and caregivers can and should do now. First, if a person is potentially disabled, they should be advised to apply for benefits with the Social Security Administration. And if at all possible, they should create an online access account with DCF, and they should make sure that their address on file and other information with DCF is up to date. Information on all of these activities can be found in the portal materials. As you can see, there's been a huge increase in the number of Florida adults enrolled in Medicaid since the PHE's continuous coverage requirement began in March 2020, and people have not been terminated, even those no longer eligible. Before the pandemic, less than 500,000 parents and caregivers had Medicaid. As of June 2022, that number has more than doubled to almost 1.2 million. Many adults who have been enrolled since March 2020 will be in the coverage gap after the PHE ends because Florida has not expanded Medicaid. To recap, during the PHE unwind, these adults will lose Medicaid either because they are now over Florida's meager income eligibility limit for parents and caregivers, or because their youngest child has turned 18. And while many of these adults will be eligible for a subsidized health insurance plan in the ACA marketplace, if their income is below 100% of poverty, they will be in a coverage gap. For example, a parent with 2 children will be in the coverage gap if their income is over $582 a month, but less than $1,920 a month. The coverage gap exists in Florida and 11 other states that have not expanded Medicaid under the 2010 Affordable Care Act, which provided 2 paths to coverage for people with low to moderate incomes. First, people with moderate incomes, 100 to 400% of poverty, would receive subsidies to help pay for insurance in the new healthcare marketplace. Second, low-income adults under 65 would get healthcare coverage through expanded state Medicaid programs. However, in 2012, the Supreme Court ruled that the ACA's requirement that states expand their Medicaid program to cover low-income adults would instead be left up to individual states. And so because Florida has not expanded Medicaid, parents and caregivers who have been receiving health coverage throughout the PHE and who are no longer eligible for Medicaid will also be ineligible for an ACA subsidy if their income is below 100% of the poverty level. In working with people who lose Medicaid during the unwind and are in the coverage gap, some helpful actions include providing them with information on their local safety net and on the statewide coalition working to expand Medicaid. Finally, individuals who lose their Medicaid and who want to share their story should contact Florida Health Justice Project.